You were involved in that budget proviso that got the universal healthcare work group started, and now this commission. When the Affordable Care Act was enacted, you led the expansion of Medicaid and the other provisions that came to us nationally. You sponsored a bill to create Cascade Care. You've paid attention or increased behavioral health resources, early developmental screening for children, and looked at the social determinants of health. Your work on homelessness and climate change and gun violence are direct public health issues, are direct issues that have a direct effect on all of our lives. And this year, you even sponsored a bill for diaper subsidy. I mean, talk about coverage for everyone who falls between the cracks in our healthcare system. I think you're really been a great leader. Even when the Democrats were in a minority, your leadership was so important. But when you stepped into that as chair of that capital budget committee, it certainly made a difference in all of these factors that lead to improved healthcare in our community. So pass on that baton so you can at least stop running for office. But I'm sure you're going to keep running in other directions and hiking and biking and moving on. You've been a champion for us. From every point of view. It's an honor to present this award to you. So thank you, David.
Well, Ronnie, thank you very much. I was really flattered when you contacted me and said you were going to recognize me in this way, and I really genuinely appreciate it. It's really nice as you kind of get towards the end of your time in this part of elected office, and for people to recognize what you tried to do, and I really appreciate it. You hit a lot of the highlights right there, and I certainly I see some of my colleagues on the phone. I just saw Senator Robinson pop in and others, and all of this is done collaboratively, but I thought I was listening to Denny Delwo, Representative Delwo, speak about how he got involved in this back in the early 90s. And it's really interesting because his connection to healthcare reform in the early 90s was also my connection, and sort of led me to be very involved in this space when I came to finally get elected in 2010. Because while he was working on it at the state level, I was a young staff member on Capitol Hill in 1992 when the first round of healthcare reform went in, and then of course it led to a political backlash, as happened here in Washington State, around the country. But I remember being struck during that time, and I was just coming into my own as a young person. I was right out of college and just kind of really coming into adulthood, really. And sort of thinking about these things deeply. And I was struck by, at that time, how many stories of people from our community for the congressman that I worked for, were going bankrupt or at risk of going bankrupt, or having their insurance policies canceled when they got sick, or after they had a heart attack, or they got cancer, and the devastation that it laid on their families, and so unnecessarily. And so as I kind of, I followed the issue, I went off and I practiced law for a while. And as I decided to, run for office the first time, it was right during the time that Barack Obama was trying to get the ACA through. And I remember knocking on doors around Seattle. And, some people don't even realize you're running for state office or federal office or whatever. And they just kind of, lump everybody together. And I remember this guy asked me, it was the day that the House passed the Affordable Care Act. And I knocked on the door of this guy, and he opened the door in a bathrobe, which is always a bad sign when you're campaigning. And he looked at me and he said, what what party are you in? And I said, I'm a Democrat. And he says, this is a horrible day for America. And he slammed the door in my face. So, and that even ends in Seattle. So my point is, this area has always been very, very contentious, politicized, difficult to communicate with each other. And I think what we've tried to do in Washington, and what I hope I helped to do, was to try to bridge some of those gaps. I'll give you an example. This last year, I was asked to serve as a subcommittee chairman for behavioral health. And we passed and everyone knows we have a huge behavioral health crisis. And there's a lot of reasons that the state kind of got into this space, this problem. But we're trying to get out of it. We're trying to do the investments to build out more facilities, which I worked on in the capital budget and Ways and Means and all that. But one thing that was really nice about this committee is it was 3 Democrats and 2 Republicans, and we passed every behavioral health bill last year with 100% bipartisan support in the committee and also on the floor of the Senate. Every single thing that we did that tried to expand, create more kinds of providers, whatever it might be. And I think the thing that we have to do, and that organizations like HCA can do, is keep talking and keep putting it out there that this is a problem that affects everybody. You may not, you may lean one way politically or another way politically, but all of us can be in that position where we don't have access to health insurance, or we get sick, or something bad happens to us, and we need a system that works better for people. And I think when you try to communicate that to your colleagues, and you try to, be willing to listen to their points of view and not just be ideological and dogmatic all the time, and try to be practical and listen, hey, maybe somebody has a point you hadn't considered. It really can make a difference in getting more acceptance. So I feel like we're in a much better place now in healthcare than we've been in a long time. And I don't think, with the setting up of the exchange, expansion of Medicaid, we passed Medicaid with expansion with a bipartisan vote back in 2012, which was kind of shocking. It was actually the Republicans controlled the Senate at that time, and we still got it through. And we basically cut a deal and negotiated. We were one of the first, Republican-controlled bodies in the whole country that was able to get, cut that deal and get Medicaid expanded. And even in those red states around the country, you've probably seen this. Whenever there's a vote for Medicaid expansion, the most Trumpy states in the world, like Arkansas, Kansas, all the people come in and vote for Medicaid expansion. So clearly people know that there's a problem with healthcare, and we just have to keep working to get the message across to people. And so that's what I try to do all these years. And I'm just really nice to be honored with this award. I appreciate I got Ronnie, I got the little package and the little bike gadgets, including the bell. I do bike around Seattle, and I've always wondered, as I pass people, they're ringing their little bell to make sure that it's safe to pass. And I'm always like, I need to get one of those things, and then I'm too lazy to get one. So thank you for getting me a bell. I appreciate that. And the other swag here for HCA. And so I'm going to try to stay involved in healthcare in one way or another. Who knows, in what capacity. Hopefully there'll be an element of public service to it in some way, volunteering or just kind of advocating. And I hope we can, stay in touch. And I hope I can work with all of you over time, as a private citizen to continue to work on this. Lastly, I just want to say again, thank you. I see many of my colleagues. I see Senator Cleveland. I see our new incoming chair of the House Healthcare Committee, Representative Riccelli, and June Robinson, and so many people. And just thank you for all the support. And let's stay in touch and keep fighting the good fight, because we're on the right side of history on this question. There's no doubt about it.
Well, thanks for moving us forward on each of those steps. And I hope you'll hang around for another half an hour or so while we move into some individual statements from legislators who you're leaving behind, but who are picking up that baton. So this will be your first chance, although you'll have many, to watch that baton moving along. So I hope you enjoy those small gifts. The bell is just perfect for you. It's not one of those obnoxious bells. It's like a chime of freedom. It's, I think, the perfect step for you, or it's not a step when you're on your bike. It's the next cycle. So thank you very much for your contribution.
Can I just say one more quick thing?
Sure.
This is very weird for me to watch my friends now as no longer the talking head that I get to be. I get to listen to everybody. So I'll be listening closely, guys.
Well, I have a feeling you'll be talking too. So thank you, David.
Thanks a lot.
So now I'd like to introduce Lonnie Johns Brown, our new lobbyist, and who is going to moderate the next panel. We're so pleased to see legislators who are stepping up to fill in David's shoes. Lonnie has been lobbied in Olympia since 1985. She's represented 20 nonprofits in the areas of healthcare and human services and women's rights. And she took a break to serve as legislative director for the Office of the Insurance Commissioner. But since spending 6 years there, she passed the baton on, like David is doing, to someone at the Office of the Insurance Commissioner, returned to lobbying and consulting on a scaled back load. We're so glad that we're a part of her plan, of her group, along with Planned Parenthood, Upstream, Quaker Voice of Washington, and Women Against Sexual Exploitation. So, Lonnie, let me pass the baton on to you.
Oh, thank you, Ronnie. It's a real pleasure to see you all today, and a great pleasure for me to moderate this panel of outstanding legislators, great peers of Senator Frockt, and folks that are going to continue to carry on the work. Ronnie, I have a technical question. So if I'm going to go in order, is there a way for us to see all of our panelists at one time? Or do I just have to call on them? Sorry, folks, this is not what I'm good at. I don't do that.
We can do whatever you want. So do you want to bring everybody up?
Yeah, I'd like to actually just do quick intros of the folks that are with us today, and then turn it over to each of them in turn to make their remarks about the coming session. So,
I think we can do that.
if not,
No, that's doable.
okay. So I know that Senator Cleveland and Senator Robinson and there's Senator Cleveland. Excellent. So good afternoon, Senator Cleveland. Thank you for joining us. I am pleased to introduce Senator Cleveland from the 49th Legislative District. She first was elected in 2012 and has served as the chair of the Healthcare Committee in the Senate for some time. She's been a real leader on a number of issues, including some women's healthcare items like access to certain kinds of mastectomy coverage. She has been very involved in maternity mortality review issues, and as the chair of that committee, has sponsored many fine pieces of legislation for many state agencies, including the one I used to work for. Joining her and us today is Senator June Robinson, who has also been in since about around 2013, and first served in the House and then moved on to the Senate in 2020. Senator Robinson has a great background in public health and other community-related issues. She has currently been serving as the vice chair of the Ways and Means Committee and will continue that role. And then in the coming session will serve as the vice chair also of the Healthcare Committee alongside Senator Cleveland. She has been a real leader on expanding funding and support for public health and primary care, family leave. With all of these legislators, I could have gone all day about all the bills that they have championed for us in the health arena. And then last but not least, we have Representative Marcus Riccelli, who was first elected in 2012. He's from the Spokane 3rd District. And he is, as mentioned already, going to be the new chair of the House Healthcare and Wellness Committee. I wish him all the best in that role, because my former roommate has in that role for a long time. So Representative Riccelli will bring a very fresh view to that role. He has also been very active in things like leading on telehealth care, helping create a comprehensive public health districts, dental access, and many, many others. So we thank you for joining us today. We have about a half hour total. And if you would like to start us off, Senator Cleveland, with what your priorities are and what you see going on in the healthcare arena for the 2023 session.
Well, thank you, Lonnie. It's so good to see you, and it's wonderful to be with you again this year and participate in this meeting. Ronnie, Marcia, it's wonderful to see many familiar faces, and I have to absolutely first recognize and thank Senator Frockt, our vice chair currently of the Senate Health and Long-Term Care Committee, and just also offer him my deep gratitude and thanks for all of the tremendous work that he's accomplished toward universal health care in our state and ensuring that there's access and coverage and health care available to each and every individual in our state. So Senator Frockt, we're going to miss you terribly, but thank you for all that you've contributed. So with that, I'll share just a little snapshot of what I see ahead in the 2023 legislative session. We have continued urgent, emergent issues that we will need to pay attention to. Obviously, we must continue to do all we can to ensure that we're recovering from the pandemic. We have to ensure that we are preparing for the public health emergency and federally. As you know, in Washington State, Governor Inslee ended the public health emergency as of October 31st of this year. However, the public health emergency does continue at the federal level. And when that public health emergency is ended at the federal level, we know that many who qualified for coverage under Medicaid will no longer qualify. And so we've been spending a good deal of time and in fact in committee just this week for Legislative Assembly Days, we heard an update from the Healthcare Authority on the process and the work that is taking place to ensure that we're prepared to help folks who lose coverage when the public health emergency ends and help to support them in finding alternative healthcare coverage. In addition to that work, we have a tremendous workforce shortage and crisis. Obviously, that doesn't just impact healthcare. There's workforce shortages in many, many sectors. But in terms of healthcare, we do have a crisis, and we need to be continuing to do all that we can to address that and to work to support and retain those hardworking professionals that have really come through a most difficult time in the last almost 3 years now that we face this unprecedented pandemic. We also must continue to do all that we can to help address the mental health crisis that we are facing. I know I just read a report that the U.S. Surgeon General put out where a survey that was conducted demonstrated that 84% of employees reported to their employers that they suffered one or more mental health issues over the course of the last 2.5 years. And so we have to ensure that we are doing all we can to support those who are in crisis, those who are facing mental health issues and need support and services. And you may already know, but we just this week made a decision to fold the Behavioral Health Subcommittee back into the full Senate Health and Long-Term Care Committee. And I'm very much looking forward to the full committee continuing to move forward and make progress in behavioral health arena. And I think that it also very much demonstrates that integration of physical and behavioral health that we as a state have been working on for many years now. Finally, I'll mention that another tremendous priority is ensuring that we're continuing to move forward as a state in protecting the right to safe abortion and reproductive health care. And so you'll see that that will be one of our priorities as well. That said, the work of healthcare, from my perspective, is always done within the framework of ensuring that we are continuing to increase access to healthcare. We're continuing to increase coverage for those who need healthcare. We're continuing to move from a system of really sick care to wellness and prevention. And I'm pleased that the Universal Health Commission has been doing tremendous work in putting together recommendations for ways that we as a state can continue to move forward in ultimately achieving that broad goal, universal coverage. And certainly want to recognize that as a state, I think that we have done with your good help and your advocacy over the years, tremendous work in really laying the foundation and laying those bricks, if you will, that will form the foundation that's going to allow us to continue to move forward toward that goal. And I know I've heard Senator Frockt mention already some of that important work that has been accomplished from the Medicaid expansion to establishment of the health benefit exchange, which I know Senator Frockt was very much a part of. We should be very proud of our health benefit exchange. It's one of the most successful in the country. The establishment of our public option Cascade Care, the establishment of premium subsidies and standing up of that program in our state, and continued work that's going to, as I said, get us to that ultimate goal of universal health care. So we're making tremendous progress. There's more to do, and I'm looking forward to working with you in the months and years ahead to ensure that we are enacting the recommendations that we're seeing coming out of the work of the Universal Healthcare Commission. So with that, I'll pause and just say again, thank you for having me here today.
Thank you so much, Senator. Next up, Representative Riccelli, would you like to share with us what you're going to be working on next year?
Well, thank you, and thanks for the opportunity to come chat with you. And yeah, looking forward to it. Just a quick note: our committee on committees hasn't met yet, so the healthcare chair position hasn't been determined at this point. But I'm certainly looking forward to it, and if it goes that direction. I just want to start by thanking my colleague and our colleague, Senator Frockt. I've worked with him on a number of things, going back from making sure kids have bright future screenings, making sure, that Medicaid kids were getting the same kinds of screenings towards autism, et cetera. Oral health care has been a big passion. He's been a consistent rock in the Senate to move forward that. And I think, he did so much work in behavioral health, but it's worth mentioning, I believe oral health is where behavioral health was about 5 years ago. And so as we continue to move that forward, his work and partnership, whether it be through the capital budget, kind of uniquely, we were able to help invest in infrastructure in our state to make sure there's more access for folks to get oral health access. Of course, expanding the work on Cascade Care. But we need these voices in the legislature. He'll be certainly missed that are really making sure the focus is access to quality health care for all people. And for me, I'm just grateful as a resident of Washington in my community. We have a lot of folks that are struggling to thrive, and I know that more people will have access in the future because of the work, and healthier, happier lives because of the work of Senator Frockt. And I would like to make sure he knows, last week at committee days, the talk of legislative hoops coming back was all the deal, and Senator Frockt is actually quite a baller. So he has an open invitation to always come down and play legislative basketball. We've always wanted to see the dunk he's been promising, so looking forward to that too. But Senator Frockt, you're going to be certainly missed, and I know that you're going to be engaged and active, and look forward to working with you in whatever's around the corner. I think Senator Cleveland nailed a lot of different things that are going to be on the horizon. Certainly workforce across the board, but healthcare specifically. I mean, COVID really put us to the test, and from our workforce in our hospitals to our behavioral health workforce, I've just been floored about school counselors, the young ages where there's suicidal ideation, where there's mental health issues. We did a lot to invest and say we want more school counselors, nurses in these schools, but if we don't have the workforce, we're not really moving the things forward. So I do think that that's going to be interesting. One of the things, because of COVID, we didn't, and I'm not trying to kick the door open, because as my colleagues know, scope of practice issues are very contentious. They take up a lot of time, but I do think, while we shouldn't kick the door wide open, post-COVID, with so much need, things that we can do around credentialing, licensing, and looking at scope of practice, if it's safe, if it doesn't add any cost to the system, and we can do it in a way that can provide folks more access, this might be the year to look a little bit. That there's a tipping point with my colleagues to how much of these issues that we can take. I've seen it, but I do think it's time to maybe look at a few things as we're coming out of COVID. I think behavioral health workforce is one of the main places that we need to give a lot of attention to. We have, I guess another thing is an aging workforce too. For me, Washington's a beacon for full access to healthcare, including reproductive healthcare. And so we're going to make sure we're doing things to shine that beacon and make sure we're not leaving any T's uncrossed or I's undotted as we look forward. And I think there's a great collaboration between the Senate and the House Democrats, between the AG's office and the governor's office, to be doing that. Public health, we're going to hear from Senator Robinson, who is a true leader in that respect, but I've been able to participate and get educated on the importance of foundational public health. Public health is really our front line of defense. We saw how we weakened it, and I think I take blame for it. All legislators should take blame for not doing what we should have. It wasn't purposeful, but we left ourselves a little bit vulnerable, and we saw the cost of that. Now we've made huge investments and significant steps forward. And so I'm looking for that. But another place where we need workforce, we had tons of people leave their jobs because they were tough jobs, because they were vilified at times. And so that's something that I think we can look at as well. I don't want to take up too much time, but I'm interested in those things that are around what we would traditionally see as healthcare as well, and they're getting a lot of attention. Food is health. I've worked a lot on feeding kids particularly, but food insecurity. We can't expect young people to thrive and live healthy lives if they're not nourished and they don't have food. So I'll be working to try and make sure all 1.1 million of our students have universal free meals. I've passed a bill working with colleagues. We're up to 700,000. I don't see any reason feeding kids shouldn't wait. And it's a great partnership with the federal government. And housing continues to be a challenge, whether it be short-term and long-term. We can't expect people to go into the hospital and get care and not have respite if they're unhoused. There's just so many challenges there. So I think I'll leave it at that. I'm very pleased that we're, with the waiver, we're looking to cover folks who previously were there because of their immigration status were not able to access healthcare. I think that's a tremendous step forward. I look forward to working with you all to make sure that we're bringing more folks in. And I serve on a number of committees that I think are working directly with you, including the Universal Healthcare Commission. So I look forward to that continued dialogue, and appreciate you all for engaging. And another big shout out to not just my colleague, Senator Cleveland and Senator Robinson, also Rep. Simmons is on here, who's a great leader in this space as well. But Senator Frockt, kudos to you and everything you've done. And I think you can see it with these folks online and how much their appreciation there is, but I want you to know how appreciated you are as well from me.
Thank you for that, Representative Riccelli, and I appreciate you talking about the interconnectedness of health and issues like housing and food as well. Something for us to bear in mind. Next up is Senator Robinson. As I mentioned, Senator Robinson will be serving as a vice chair of two. Talk about interconnected healthcare and the money that we need to support healthcare, and the work that she's done to expand access to immigrants to healthcare. And so I look forward to hearing what you have to share with your thoughts for next year.
Thanks, Lonnie, and thank you all for having me, and especially a shout out to Senator Frockt as he finds what's next for life for him. I had the pleasure of working across the rotunda with him in the House, and then joining the Senate for the last 2 years. Unfortunately, we were mostly remote during that time, but I did thoroughly enjoy sitting on the Healthcare Committee with him, especially when he would go into full prosecutorial mode against whoever was the villain in the particular bill at that moment. I really enjoyed those moments, and I will miss those. I'll try to channel it, but I'm just not a lawyer. So as far as the upcoming session, you've heard a lot. I don't want to repeat what Senator Cleveland and Representative Riccelli have already said. I certainly am supportive of all that they've talked about. I do want to just emphasize what, I want to shout out to Gary Goldbaum, who's on here too, our former Snohomish County public health officer and health district administrator, and a good colleague when I first came to the legislature. So it's nice to see you, Gary. We have, in the time I've been in the legislature and it preceded me, we've sort of incrementally expanded access to affordable health care for Washingtonians, and I'm really proud to be a part of that. And Senator Cleveland laid that path out nicely in her remarks. But the next step is standing up a state-funded program for the 100,000 Washington residents who are ineligible for Medicaid or, government-sponsored programs, basically Medicaid or purchasing on the exchange due to their immigration status. These folks are here, they're our neighbors, they're working, they're paying taxes, and completely ineligible due to federal regulation to access affordable health care. So we are taking steps as a state to stand up sort of a two-pronged program that will provide access for those folks. One part of it is Medicaid lookalike program. So it'll be completely state funded because we can't draw down any federal match for immigrants, but it'll look like the benefits. We're trying to mirror Medicaid benefits as much as possible. And that'll be for folks under 138% of federal poverty level, just like expanded Medicaid is for those folks who are eligible. And then the other piece of it is get the Health Benefit Exchange has applied to the federal government for a waiver to allow us to allow immigrants to purchase plans on the exchange. And then we need funding from the state to help subsidize those, to provide subsidies, since they won't be eligible for federal subsidies. And that exchange part of the initiative will be for folks over the 138% of poverty. So it's really, in terms of your advocacy and your engagement, I hope that, because this really is the next phase of expanding access to healthcare for all Washingtonians. I hope that you'll engage and really encourage your legislators and the legislature broadly to continue to make progress on standing up this important benefit for immigrants. We gave the Healthcare Authority and the Health Benefit Exchange some initial funding in last year's budget, but we're going to need significant new or additional investments going forward to actually pay for the benefits for the healthcare on the Medicaid side, and then for the subsidies on the exchange side. So really, it's important that your legislators hear from you about this need in the state budget. Speaking of the budget, it is going to be tighter than it has been in the last few years. We were very fortunate in the last couple of cycles to have significant federal dollars as a result of the pandemic. That really helped us write fairly robust, I would say very robust state budgets the last 2 years. We were able to put a lot of good dollars out into the community to stand up things around housing and rent assistance and food assistance and all those additional investments in childcare and early learning, and a lot of good stuff that people need to be successful and thrive in their communities. It's going to be harder this year, and I'm sure we won't be able to make those really historic investments that we've seen over the last 2 years. But I just want to put this particular piece on your radar so that you can be advocating for that investment in the budget, so we can continue to be a leader in the country and just serve the people of Washington and really continue to open up access to healthcare for all. So that's what you're all about. And I think this immigrant program is the next step that we need to take as a state to ensure that coverage.
Thank you so much for your remarks and your leadership on that issue, Senator Robinson. Next up, as the newest of the folks on this panel, Representative Tarra Simmons was first elected in 2020 and just succeeded in her first re-election. So welcome. She's from the 23rd Legislative District, which has Bremerton and Bainbridge Island. She had a remarkable first session. She sat on the House Health and Wellness Committee, was Vice Chair of Civil Rights and Judiciary, and was on a couple other committees. In her first sessions, she passed legislation creating the Behavioral Health Advocacy Office, sponsored the Charity Care Act update that passed, and updated the healthcare workforce eligibility process. So that just a few of the things she accomplished in that first term. So welcome and thank you for being here, Representative Simmons.
Thank you so much, Lonnie. I definitely don't deserve to be amongst these giants, but I'm grateful. And Peter Lucas is one of my favorite constituents. So whenever you want me somewhere, all you have to do is send Peter in and I'll be there. And I just want to say, since everybody else said, I feel very cheated that my first term was on Zoom and I never got to work with Senator Frockt, because he is a giant among giants and so incredibly humble and kind and thoughtful. And I feel really cheated that I just went and sat on the dais for the first time in Olympia the last 2 days and I never got to work alongside him. So I hope he doesn't stay a stranger. I guess I'm going to have to pick up basketball to see him. And I will do so if I have to, even though I'm only 5'2". But I guess one of the things is I do work mostly in criminal justice, and at the intersection of behavioral health and criminal justice, that's kind of my real area of passion. But I was a nurse for 11 years, and my nursing career started in the emergency room, and then I worked in long-term care, med-surg, and ended my career 6 years with an insurance company as a disease management nurse. And so I bring the firsthand experience of being a nurse to the legislature And although I keep saying I'm going to work on criminal justice, actually this coming session, I think I have 6 healthcare bills and only 3 criminal justice bills. But the biggest impact I can make right now is advocating to get Rep. Riccelli as the chair of the committee, and in hopes that he will continue to teach me and mentor me so I can find my way to have a bigger impact on healthcare, because I do see healthcare for all as being kind of prevention for criminal justice involvement later on in life, and especially for children and people with behavioral health issues. Right now, I've been spending some of my time in the interim implementation of the charity care. I was really proud to pass that bill as a freshman and expand charity care access to so many Washingtonians who really need help to avoid bankruptcy. I live in Kitsap County, where we have a real problem with our hospital. We only have one hospital, and it's a Catholic hospital. You know, in my community, it was the nurse who called 911 for help because it's been mismanaged so much. So, you know, I'm really looking forward to supporting Rep. Riccelli, who's been a leader on safe standards for the nurses. I absolutely know what it's like to be an ER nurse and not be able to care for your patients, or actually a med-surg nurse. I put my license at risk so many times when I was a traveling nurse and didn't have the right supports. And my heart grieves for the nurses, but also for the patients who are receiving care. So I'm going to support him in whatever way he asks me to, because he's a leader in that. I am running a companion with Senator Randall, who is in my neighboring district, on the Keep Our Care Act, because the mergers and acquisitions have left our community without access. And we really need to pay attention to that, especially in a post-Dobbs world, where some hospitals will refuse to provide abortion services or other reproductive justice, LGBTQ, and death with dignity services. So I will be working with Senator Randall on that, and also around raising the pay to be equitable for nurse practitioners who provide the same services as physicians. I'm also introducing a bill around pre-authorization and trying to streamline the process for providers who need to get care, patients that need to get care with the insurance companies who sometimes delay that care too long. So I'm working on a pre-authorization bill. And a passion of mine, I have a constituent here. Again, I am a person who was a nurse for 11 years, suffered with substance use disorder myself, went through the Washington Health Professional Services Program to keep my RN license, and now have 11 years in recovery. But one thing is that people that have gone through that program, nurses and other providers, we have a stigma on our licensure on the Department of Health website for life. And I have a constituent here who has been in recovery for 10 years. And when you look up his license, it's still there that he has substance use disorder, and he, feels like he can't leave his job because of that. So, nurses and healthcare providers are people too, and we suffer with behavioral health issues, and we need to stop stigmatizing care. And we want our workforce to be healthy, because if not, that's why we have so much turnover and burnout. And we want to incentivize people to get care when they need it, and not stigmatize them for life. So I'm going to have a bill around that too. And just in general, I am going to continue to be an advocate for access, affordability of all healthcare, but particularly behavioral health. So whenever there's something that Rep. Riccelli can task me with, to go knock on doors or make some moves to increase access through workforce development, or just funding for behavioral health, I will be at his beck and call, and be happy to do that. So thank you so much for having me, and for all the work you do. I look forward to continuing to learn from all of you and my colleagues that are on this call. And Senator Frockt, thank you so much for your selfless service for so many years. It's a hard job. I've only done it for 2 years, and you did it for a long time, and Washington is better because of you. So thank you.
Thank you for your remarks, Representative Simmons, and can see it's going to be another heavy load for you again next year, and all good. issues that need to be addressed. Ronnie, I'm kind of looking to you. Do we have time for any questions for our panelists?
Well, we'd like to show the video from Senator Keiser. So can we do that now? Ron will run that for us.
Yes, please. But I want to make sure that in case I think Representative Simmons has to go, that we thank our panelists for taking time out of their weekend to come with us, share all of that information, motivate us, and kind of lay out the work that we need to do to support your visionary ideas for next year. And especially on top of the fact that you just spent several days in committee assembly days in person, which I found very, very exciting and tiring all at once. So thank you so much for sharing your Saturday with us.
Shall we go ahead with Senator
Yes.
Cleveland?
Yes, Keiser.
Keiser, sorry.
Hi, everybody. I'm sorry I can't be with you in person this year. I first want to say congratulations to Senator David Frockt on his awards. He has earned them. He worked so hard on Cascade Care and the public option for health care. Now, for my message to you, I would like to inform you of some news, and that is that I am stepping away from the Senate Health and Long-Term Care Committee. I have, ever since I've been on the Senate side of the legislature, been a member or chair of the Health and Long-Term Care Committee, and I've had a wonderful time working on many, many issues with you and many other advocates. I know that when I began the work, we had an uninsurance rate in our state of over 16%. When we finally got the Affordable Care Act implemented, we were able to bring that uninsurance rate down to really less than 5% now. And with the new Cascade Care plan, it will go even lower. And that is just terrific in my opinion, because healthcare is necessary for all. Now, another area that I turned to was prescription drug prices. And first we passed an all-payer claims database, and then we passed the drug transparency law. Then we were able to put a cap on insulin, and then we were able to lower that cap from $100 a month to $35 a month. And last but not least is the recently passed Prescription Drug Affordability Board. That will give us a lot of leverage and should bring the skyrocketing increases of prescription drugs under at least a little bit of control in Washington state. I am, of course, still working on a lot of issues that involve healthcare in our Labor and Commerce Committee. And as chair there, I want you to know that I'm going to be working on a bill that will provide health insurance to striking workers. You know, when people go out on strike, the employer sometimes stops paying the premiums for health insurance. That's a leverage point that really hurts. This will be, of course, vigorously opposed by employers. So please keep that in mind as we work on these issues together. And I do look forward to working together with you again in the 2023 session. Thank you for all you do, and thank you for inviting me.